is Dr. Patrick Mutai, who is the Chairman Appointments Committee, as well as the Speaker of this County Assembly of Kericho. For purposes also of record, is that Dr. Ekuwam is well known to me. I served together with him in the last regime when he was the Chief Officer in charge of health, whereas I was the CEC in charge of finance and economic planning. And at some point in time, I also acted as the CEC for public works, roads, and transport. So in case, Dr. you have forgotten me, this is the same Patrick that we served together in the last regime, and I'm happy to see you here this afternoon. But that doesn't mean that it will affect the work of this committee. And Dr. let me take this opportunity to congratulate you for being nominated as the CEC in charge of health services for this county government. And we will proceed with administration of oath.
David Ekuwam, do swear that the evidence we shall give before this committee is the truth, the whole truth, and nothing but the truth. So,
all right, thank you, Dr. As you are aware that you have been nominated for the position of CC Health Services, previously, of course, you served as the Chief Officer in charge of the same department. And honorable members, we shall not dwell so much because I want to believe the officer before us knows or is aware of the very myriad challenges or even how the Department of Health operates in the county. And Ekuwam, I think, Dr. I'll request you to introduce yourself to this appointment committee, who is David Ekuwam, Dr. Of course, we have had an opportunity to look at your CV, but just introduce yourself comprehensively in a manner that you can touch among many other issues. Of course, your background, who are you, your work experience, maybe the employment records, your honors and awards, professional associations, if any, membership, if any, and anything else that you want us to know about you. Dr. Your education, so that honorable members, because of our vetting tool, please note if the nominee has introduced himself and touched on the matters of the components of what you are expected to ask, then there is no need to repeat it. Just introduce yourself, let me just say comprehensively, and even relate your introduction to the docket that you have been nominated to. That is more so on the aspect of whether you have the interests and the knowledge relating to health services, so that we can move in a fast manner. So, Dr. you are free when ready to introduce yourself as you touch on all those areas and even any other area that I may not have directed. Please proceed, Dr.
Good morning, actually good afternoon. I would like to take this opportunity to thank this Honorable Assembly
for the opportunity to be here, and His Excellency the Governor. My name is Dr. David Ngiligo Ekuwam. I am a consultant ophthalmologist by training. I was born at a place called Maralal in Samburu County on the 7th of July 1971 as the firstborn son to my parents. I went to primary school within Maralal at a school called Maralal Primary School for 8 years, and I happened to be the best candidate in the county. Subsequently, I was admitted to Maralal High School for my O-level education, and I spent 4 years in that school, also emerging the best candidate overall in the entire district. Also as the pioneer doctor from Samburu County. So I went to the University of Nairobi for a 6-year program between 1993 and the year 2000, eventually graduating with a degree of Bachelor of Medicine and Bachelor of Surgery. Subsequently, I went for a 1-year internship course, training at Eastern Provincial General Hospital, Embu, where I became the team leader for the interns group, and subsequently posted to work in several places, including Moyale Sub-County Hospital, Makindu Sub-County Hospital in Makueni, and later I was posted from Makindu to Turkana, Lodwar County Lodwar Hospital, which was a district hospital then. In 2004, I was fortunate to advance my studies further. I went to back to the University of Nairobi for a master's degree in medicine, specializing in a field called ophthalmology, which is basically eye care services. And in the course of my training at the reason why I applied to study ophthalmology is because of the challenges that I encountered as a general medical doctor working in Moyale, which is in Marsabit County, working in Makindu in Makueni County, and also Turkana. Particularly in Turkana, I've encountered a lot of patients with eye problems that I was unable to handle as a general medical practitioner. And I felt that something needed to be done. And to be honest, at that point, the number of eye care practitioners were quite low in the country. And as a person, I always take challenges head on. Whenever I encounter challenges, I don't run away. I don't shy away from challenges. I confront the challenges, try to understand, and provide the best possible solutions. So I went to the University of Nairobi for a master's degree in ophthalmology, and when I graduated in 2009, I was deployed to serve here in Kericho from February 2009 to date. So I've worked in this county for a total period of 16 years to date. I live in this town. I'm a resident of Kisumu Road, which is in Kipchebor ward. And that is where officially. In the course of working here, I've risen through the ranks, starting as a consultant in the eye care services at the Kericho County Referral Hospital, rising to while I served as the in charge of with partners within the eye care space, particularly the Kenya Society for the Blind. We were able to engage, and I became a member of the committee of the Kenya Society for the Blind that had a CBO based in Kericho and Bomet, taking care of eye care issues. During that period, we were able to lobby for the establishment of an optical service at the Kericho County Referral Hospital, the second hospital in this country to establish optical services after Turkana County. While I served as the in charge of the eye unit, I was a member of the hospital management team, and the medical superintendent then was able to nominate me to assist as the chair of the tender committee of the hospital, which I served with the dedication. If the records of the hospital, including audits, are anything to go by at that time. So during the course of my working here at the Kericho County Referral Hospital Training College, that was a 6-month training. I also had an opportunity to train in hospital operation and management in Korea, South Korea, for a period of 3 weeks. I am a member of the Kenya Medical Association, Kericho branch, also a member of the Ophthalmology Society of Kenya, in good standing, and a life member of Kenya Red Cross Society. After serving while I was serving at the County Referral Hospital with the devolution of services in 2013, with the incoming of the devolved system of governance in this country in 2013, some changes had to be undertaken. Health services was one of the departments that were devolved, one of the services that were devolved. As a result, I was nominated. I was actually appointed in 2014 to become the medical superintendent of the Kericho County Referral Hospital, and I served in that capacity for a period of 3 years. Healthcare staff to embrace devolution. I would like to say that embrace devolution. I would like to say that with the leadership that we were able to work, and we were able to convince our health care workers that we are here now, devolution is here with us. There will be challenges, of course, of any new system, but we are up to the task. We will work together. We will try to navigate the challenges, and eventually we will emerge victorious. As many counties have had challenges, Kericho, we've tried to navigate. We are not yet there, but it is what we call work in progress. So I served as the medical superintendent for a period of 4 years, and at that time, other than the HR, human resource for health challenges, the revenues for the county referral hospital were at an all-time low. Because I remember the 2015 financial year, we were only able to raise 6.8 million for a period of 3 months, which was too low compared to what was being collected previously, which was about 12 million per quarter. So despite that, we were able to work with the staff and with the hospital management team, and we were able now in quarter 2, the revenue was able to, we were able to increase the revenue from 6.8 to about 10 million, and eventually by quarter 3, at a time like this, we had recovered to, actually we had surpassed the target. We were at 12.6, and eventually the revenue started going up. By the time I was leaving the office of medical superintendent to become the county chief officer for health services, the department was doing an average of 30 million per quarter. So I attribute that to persistence from our end, together with teamwork from the entire health. And I can assure you that the other reason that enabled us to achieve this is the fact that our staff realized that the money that we were generating as a hospital was plowed back to improve services. Because initially there was skepticism that probably the money would be mismanaged and probably the money would go to other places. But we were able to reinvest the money with the support of the chair here while he was serving as the CEC. He was able to lead our team. At that time, was able now to allow health services to become vibrant. Thereafter, between 2017 December and 2022, I served as the county chief officer for health services in this great county of Kericho. That I would like to sincerely thank the former governor for the nomination and the appointment at that time. And working with the leadership at that time, we were able to achieve quite a bit. We were able to improve infrastructure across all the sub-counties. We were able to expand services in all the level 2, level 3, level 4, and even level 5 facilities. We were able to hire over 500 staff between 2018 and 2022. We were now able to give better services. We were also able to improve the health indicators in the county across basically reduction of maternal mortality rate, infant mortality rate, under 5 mortality rate. All those indicators were improved as a result of the investments that we were able to implement under the leadership of the CEC then and myself. The Department of Health Services has been able to get to partner with quite a number of development partners, international as well as local, and the consequence of that is that we were able to get donors to invest in capacity building of our staff and also infrastructure development. Thank you.
Thank you so much, Dr. David Ekuwam. You have introduced yourself very well. Because of time, I know members you have noted as he introduced himself, he has covered a wide area of your interests in terms of the vetting tool that we have here. But just maybe for the, so that perhaps you can summarize. You know, Daktari, you have been with us, actually with this county government. More so I want to speak from the onset of devolution. And I hope the honourable members, you have gone through Dr. David's CV and you have seen the achievements since when he was the chief officer, or even from when he was the medical superintendent, the head of ophthalmology, and we can say that you are among the doctors who actually are pioneers when health services functions was devolved. Just to summarize, and as you are aware, I know you have been there as a chief officer. Now that there is a proposal that you have been, or you have been nominated to be the CEC, maybe just within 100 days, Daktari, should you be appointed, not even 100 days, or within your first days in office, what will be your priority actions given you are conversant with the health sector in Kericho County? There are so many things that are happening at the moment. For instance, last week we saw doctors issuing strike notices. This assembly has received numerous complaints regarding, for instance, non-functioning of oxygen plants. There is the issue, of course, perennial complaints of shortage of drugs, the aspect of revenue leakages in the hospital, among other issues. Maybe you'll just touch on that because I'll not ask you anything other than that. And then lastly, with the partnership between the national government and county governments, in the this is actually on the issue of SHA, Social Health Authority, and county government, for instance, now of Kericho. Maybe what are your thoughts and how can this program be a success in our county? That will form part of my questions, and then I'll just open the floor and we'll be picking one from the honorable members. Maybe you can respond to that, Daktari, and then I'll give it to you.
Thank you, Honorable Chair and members. Within the first 100 days of my leadership, if approved, I would focus on the 6 building blocks of health. Health sector has 6 main building blocks. In terms of human resource for health, because health is basically a service industry. So the focus, the principal focus should be health services delivery. So under human resource for health, the first thing that needs to be undertaken is confirmation of staff. We have close to 900 staff on contract. This assembly has been gracious enough to allocate resources for confirmation of this staff. The process of confirmation started in December. Suitability interviews were conducted in January. So one of my first tasks is to ensure immediate release in liaison with the County Public Service Board, immediate release of the results and issuing of confirmation letters to over 500 staff to permanent and pensionable status. That would go a long way in restoring confidence among staff and lead to motivation. The close to 400 staff will be left, about 350 This is an assurance that the process has begun, and with the support of this assembly, phase 2 is coming. I have full confidence in the ability of this House to be able to achieve this. My experience as the county chief officer has taught me that we have had a lot of staff exiting the county public service because they were on contract, leaving us exposed. Because the reason why we hired them in the first place is because there was significant, there was a huge gap in terms of service delivery. We had a lot of facilities that we had completed, equipped, but then they could not be operationalized. So we had a number of staff exiting Kericho for our neighboring counties, and also some leaving the country for greener pastures. I believe with the confirmation of this staff, we will be able to keep our people safer. Secondly, we have a number of healthcare staff who also need to be promoted. Our staff, because a motivated staff will give better service. So promotion of staff, the department has already submitted a list of all staff, and we budget on an annual basis for promotion. So the process has been a little bit slow, but I believe this should be concluded within the 100 days. I'll be in office if approved by this committee. The other thing is we have a number of facilities, about 17 dispensaries that are complete, equipped, but not operational. I want to undertake and confirm to this assembly that once approved, and within these 100 days, it should be possible to operationalize those facilities, because a lot of resources have been pumped into this, and it would be unfair to the residents of the county to have facilities that are not functional. In fact, it is a waste of resources. Any day that those facilities are not in operation, lives are lost, diseases get complicated, because it means residents will have to travel far in order to access medical care. The other thing is for human resources for health, we have officers. We need to motivate our staff through continuous professional development that can be done locally as well as externally. Career development is an important matter that needs to be looked into, because we expect it is a motivating factor when staff who wish to advance their studies so that they get better knowledge, so that they are able to give better service, are taken care of. The other issue is health products and technologies. This refers to medical commodities. We have had a lot of stockouts. Actually, just to tie up the issue of human resource for health with the issue of strikes. Staff who are not motivated are likely to be grumpy, and you find that they may issue strikes from time to time. I can assure you that while I served as the county chief officer, we were able to engage. We were able to engage with the staff from time to time through their leadership, the unions. We did operate an open door policy where staff members would feel free to walk into our offices and even call me at any time to raise their issues, and I would have a listening ear, and we were able to resolve most of the issues. In fact, most of the issues you find in health can easily be resolved by people sitting down and talking. The moment you ignore complaints from staff, then that is where now we find ourselves in trouble. The impending strike of doctors is I looked at it when the strike notice was issued last week, and the issues they raised are things that are very important, but at the same time, these are things that have been discussed by the county leadership, the chief officer, the director, the county executive committee, the acting CEC. So these are issues that have already been discussed. The only thing that needed to be done was communicate effectively with the union that doctors have been, health workers have been recruited, promotion is in process, confirmation has been done for most of the staff, actually in process, and release of those who require to go for further training has been processed. And for situations where it may not be possible to immediately release an officer due to service delivery challenges, those things need to be discussed clearly and openly with the staff so that they understand they may not be released immediately, but in the subsequent years when the others who have gone to school come back, we are able to release them. So I believe this matter of the doctor strike, the only challenge that we have had with the doctor strike, for example, is the issue of medical insurance. Medical insurance is under public service management, but in cabinet, these are matters that can be handled at cabinet level, because the medical insurance does not only cover health workers, it covers all the workers within the county executive. So I am aware that we have a budget of about 60 million against the required budget of 460, which with my experience in health management at chief officer's level, I know it may not be easy to get the 460 at once, particularly during supplementary. I wish to inform this committee that given an opportunity, we would present a proposal to improve this, because medical insurance is so important. So I would wish to present to this House through the CEC for Finance and through the collaboration of Cabinet, if approved, that more funding be considered for medical insurance of all the county staff. On the issue of health products and technology, this refers to medical commodities. We, in 2021, with the support of the national government, there is what we call quantification and forecasting that was done here in Kericho. This refers to a situation where we want to know what amount of drugs and pharmaceuticals, nutraceuticals, and others that we require to serve the entire county population for a period of 1 year. So we already have that figure. The figure is 850 million. We require this figure for the entire year. We understand we do not have enough budget to be able to take care of all this. The budget we have at the moment is about 220 million for 1 year. What I intend to do is to sit down with the county chief officer, who is the accounting officer for the department, together with the medical superintendent, because they also raise revenue through FIF, to look at the budgets of FIF so that the bulk of that budget takes care of health products and technologies. So there could be, maybe the budget is not properly aligned, so that we have a larger proportion of the health products and technologies, of the budget, taking care of health products and technology, because the facilities we would I expected, like the target for this financial year, for the next financial year, for this financial year is about 646 million. So meaning that the hospitals would probably generate about 400 of this. Yeah. Then on, so because really it is a disservice to Mwananchi. It is a big disservice to Mwananchi to come and interact with the healthcare facilities and then live without drugs, without a service. That would actually not even be considered a service, really. So when we have medical commodities, lab supplies, X-ray supplies, then it makes it worth. On the issue of infrastructure, I understand that the budget of the department, only half of the budget is available in the first 6 months of the financial year. So most of the first charge to the budget is usually pending bills. So usually when the second half of the budget is opened at the beginning of the financial year, that is when the entire budget now becomes available, and most of the infrastructure projects we are now able to process through the process of procurement until we are able to roll out. I intend to closely work with the county chief officer and the other health workers, particularly those in management, to see that most of the projects are rolled out in order to ensure absorption of funds is hastened and raised. On the issue of leadership, we have, with the universal health coverage rollout, I strongly believe in primary health care. Primary health care is the cornerstone of health services. We have the primary health care bill that takes care of most of the funding issues. But I am aware that we have a community health services bill before this House that has been processed, and I intend, once approved, if approved, to liaise with the Committee of Health Services to see that that bill eventually becomes an act, so that we give power to the primary health care aspect of health, right from the community health promoters, dispensaries, level 1, level 2 dispensaries, level 3 facilities, all the way. So then the other thing is we have health, we also have facility management committees. These are members of the public within the vicinity of the various level 2 and level 3 facilities. These people are very important because they are the owners of the facilities. So I would like to ensure that, if approved, I would like to ensure that these committees are properly empowered. They undergo at least some basic training, and to also work with them, to work with them and to ensure that, to assure them that the office of the CEC will be available for consultation at all times. Because once the facility management committees are able to work very, very closely with the dispensaries, then we are sure the quality of services are expected to go up. The other thing is about supervision. I would like to say that the supervision of health facilities has not been very strong in the past. And that is why from time to time you find complaints here and there that a certain dispensary has not been opened by 10 o'clock, by 11 o'clock, or the facility has been closed too early. I am a believer. Complaints do not just germinate from nowhere. Whenever there are complaints, definitely we do not need to dismiss them. We need to listen to wananchi and address. So with supportive supervision, which we intend to roll out across all the county, we intend to have regular support supervision through the office of the county chief officer being the authorized officer.
Thank you, Dr. I think you have elaborated so well on your introduction, as well as touched on members. On the members, we agree that he has covered our vetting tool up to around 95%. Just a few ones that I want to ask you. They are straight ones, so that we can move on. Daktari, just to ask you whether you have ever been dismissed or otherwise been removed from office for contravention of provisions of Article 75 of the Constitution. It's just straight yes or no?
No.
All right. Have you ever been adversely associated with practices that depict favorism, bias, nepotism in discharge of public duties?
No.
Have you ever done by way of pro bono or charity? List any specific if you have been doing those things? I just even like charities, yes?
Yes.
Okay. Any?
Participation in church activities.
Okay.
As well as supporting the needy in the community through paying school fees.
Thank you.
And also conducting free medical camps.
All right.
Yes.
The other one is, do you have any objection if this committee make inquiries with your present employer, of course, in reference to your nomination here?
No.
All right. And then about published writings, if you have any titles, any published article that you may want us to know, be it articles, report letters to the editor, published materials you have authored or edited, if any, do you have them?
I did my master's degree in ophthalmology, University of Nairobi.
All right.
So I can actually avail a copy of the thesis report. It was on diabetes and eye care.
All right, that one, that is okay. So for purposes of the information that you are going to avail, you will liaise with our officer, Abraham Langat. And then the next one is, what is your financial net worth? Your statement of net worth, Dr. Present, an estimate.
As a public servant, every 2 years I've been declaring my wealth as required by the Public Officer Ethics Act 2003. I have a copy of the last declaration that I made on the 1st of November 2023, and between that time and now nothing much has changed in terms of my net, in terms of my declaration. I would like to say that my net worth is about 60 million, and mainly composed of ancestral land at the CBD of Maralal. Being the firstborn, I have the rights to have to lay claim to it. I have some real estate plot in Maralal also. I'll put it at about 30 million. I have a plot in Eldoret, Kitangela. I have motor vehicles, shares in Afya Sacco, Kenya Medical Association Sacco, Kokwatai Sacco. I have livestock in Eldoret, and I think that is it.
Okay.
Yes.
Of course, you will also provide the same documents to Abraham. Now, the other area is on the issue of potential conflict. If you anticipate any, and should you be appointed, and should there be any conflict of interest, maybe what are you expected to do?
Generally, I do not expect to have this, but in case it arises, I will declare and step aside to allow the others to make the determination on a matter of interest.
Okay, thank you. Have you ever been charged in a court of law in the last 3 years?
I've never been charged in a court of law in my life.
The last one is, have you ever been adversely mentioned in an investigatory report of Parliament, County Assembly, or any other commission of inquiry in the last 3 years?
No.
Adversely, being mentioned adversely?
No.
Okay. So that is it, Daktari. Honorable members, I think we have covered our vetting tool. Are you a member of any political party?
No.
Oh, okay. All right. I think then we are through with our vetting tool, and therefore I want to open the floor. And honorable members, I want to believe you have been very keen, because Daktari has kind of clearly exhausted all the, I want to believe, the questions that you had, perhaps maybe on the problem of solving a bit that I expect that we have those questions. So let us stick to one question each first. When we say one, honorable members, it is one. I don't want to say I won and then the next one. So it's one. One, the leader of majority. And then we will take four from here. From leader of majority to Honorable Borogoni. Four observations or comments or questions to Daktari. Please, the leader of majority.
Thank you very much, Chair. I know it's because of time. First question, Daktari, is in previous government under Professor Paul Chepkwony, you served as a chief officer, and then immediately after the entry of the new government under Dr. Eric Mutai is when you went back to the facility, and for that case it's capcated to aid ophthalmology department. Now you've been brought back. What is this unique thing that you think maybe the appointing authority have seen in you that they didn't see immediately they enter into this government? Number two, it was restricted actually to one.
Yes, to one, please. The Honorable Maritim.
Okay, thank you, Chair. My questions are summarized. That is one question. I want to ask Daktari, what is your take in increased cases of medical mismanagement, which is medical negligence, unconsidered transfers of health workers, selective routine trainings in the sector? Thank you.
Yes, the Honorable Eric B.
Chair, allow me, thank you, Chair, and you allow me to...
you just do one, will come another round. Just one first.
Welcome, Dr. Ekuwam. And my questions straight away goes to you concerning the issue of the notice which has been given out for the doctors' strike. I hope you remember there is a CPU which was harmoniously or agreed during your tenure. I would like to guide us that when you made an agreement with the doctors, why you were not as a chief officer in the previous government, what did happen so that you never fulfilled their promises regarding to the medical insurance, and of course the promotion when we aware that we used to give you budgets for doctors so that they can improve on the issues of promotions. Regarding the same, there is an issue of oxygen plant. I remember you've had, for the last 1 month, we've been having cases concerning the shortage, or actually the issue of non-functioning of the oxygen plant. When we visited there, we found that the oxygen plant was put in place in the previous government, whereby you were the chief officer in charge of the department. You've seen there are so many agreements you did, and when it comes to the service agreement and for the servicing the same oxygen plant, it was not put in books so that the department can be able to work on the same. They have a lot of crises when they are looking for their contact services, they are not be able to get. So what is that thing you are telling us as a chief officer who was previously working in the department, and now you are coming in to sit as a CC? What is that thing you do to ensure that the contact services for the same oxygen plant and be able to function well, so that we should not be having cases of mismanagement and of course losing our people within the referral hospitals, and of course bring to our attention that what is that thing you can do to improve the utilization of the drugs. You are aware that the camps and things is there, and of course right now you are using SHA. What is the improvement you will put in place to ensure that we should not be able to lack drugs completely in the department and in our hospital? Thank you.
Thank you, Chairman, for help.
Thank you. Once again, Dr. Ekuwam, welcome to this committee. There are issues that I was to ask, but I'm happy my colleagues have touched on, especially the shortages of drugs. Let me then go straight. Dr. Ekuwam, you are the chief officer in charge of health. In fact, when I was elected in 2022, the first person I met as a chief officer was you in health, because that's where I came. Dr. Ekuwam, we have some facilities in this county that are not operational because of lack of personnel. I want you to convince this committee on the strategy that you intend to use to ensure some of these facilities are, with the requisite number of staff. You are also aware when SHA was implemented, a facility like Roret Health Center was downgraded from level 4 to level 3B, because the reason was it did not have the requisite personnel. It means if we had a doctor who is in charge of Roret, he will then be moved to Kapkatet or Sigawet because downgrading happened. We have a facility like Cheptuyet dispensary where I come from. It was offering maternity services, but because of SHA, it will not be offering maternity services. It is supposed to refer patients to Sigawet or any other facility. And lastly, Dr. Ekuwam, we have a challenge in our county referral hospital, Kericho. And I want to report to you that the management, led by the medical superintendent, we have the people under MedSup. One is the manager in charge of the nursing section. Dr. Ekuwam, that particular individual is not qualified to run or to be in that position. What I'm putting to you is the requirement by the Kenya Medical Practitioners and Dentist Board is that whoever was supposed to be in charge of that particular section must hold a minimum qualification of a degree. But the person in charge of that is a holder of a higher diploma. if that board comes to that referral hospital, it will be downgraded from level 5 to level 4 because of such, disparities. I want you to tell this committee, what do you intend to do so that we ensure some of these things are properly in place, because it is a requirement by law. And lastly,
thank you.
I'm done.
We said one and the honorable professor.
I'm done.
We'll still come to you.
In fact, this one is not even a question.
Okay.
Dr. Ekuwam, I got an SMS.
Yes.
From a concerned citizen that while you were serving as a chief officer, you insulted a member of county assembly in public. You will tell this committee whether you did that.
Okay, thank you. Now, honorable members, we will expect Dr. to tackle the 4 observational questions from our 4 honorable members from the leader of majority, and then immediately thereafter, there are no supplementary questions. I direct as the chair. We now go to, from my right hand here, the Honorable Vincent Tuesday, Honorable Francis Terrer, and then from there we can now open the floor if there is anything. So you will answer the 4, but honorable members, I want to request that I exit the stage at this moment. I'll be joining you shortly at around 3:30. 3:30 is when the next nominee shall appear before this committee. From now onwards, the vice chair will take over from where I have left. Dr. Ningilo Ekuwam, I wish you all the best. Please respond precisely, and this is an interactive session with this assembly. Thank you so much.
Thank you. Honorable Chair and honorable members, thank you for your questions. I would like to start with the question from the majority leader, the leader of majority, Honorable Philip Rono, on my circumstances after leaving the office of the county chief officer at the beginning of the 3rd cycle of county leadership in 2022. At the expiry of my 5-year contract with the executive, I reverted back to my previous engagements because I'm an employee of the county government of Kericho. I'm a civil servant, and I had applied for leave of absence for the 5 years. So at the expiry of the 5 years, I reverted back to my previous substantive position. And in the wisdom of the county chief officer at that time, I was deployed. Previously, I had worked at Kericho County Referral Hospital, and with the wisdom of the leadership at that time, they felt that I needed to also offer my services at Kapkatet Sub-County Hospital, which is equally a large hospital. It's a level 4 hospital. And the services of an ophthalmologist are required at that level. I would also want to say actually at the time of my employment as a public servant, I signed a document to say that I will be willing and ready to work anywhere in the Republic of Kenya if posted without complaints, and I've done that. So that deployment was proper, and I was able to take that position, and I thank God because I was able to bring changes to ophthalmology care in Kapkatet. So the leadership that I offered at the time I served as the county chief officer is what may have motivated His Excellency the Governor to reappoint me to leadership once more, even at a higher level, not the previous position. I believe my work speaks for itself, and I was able to do a handing over report that indicated that I was able, with the leadership of the CEC then, to move the department from a lower position to a better position by the time, with better health indicators. So that is the leadership that His Excellency the Governor, I believe, saw in me and felt that I could serve even better in the new in the position if approved. On the issue, on the question of raised by the Honorable Member for Chepsion, Honorable Maritime, the issue of medical negligence. Anytime, one thing I would like to say categorically is that health workers work under very difficult conditions. To be able to offer quality health services, the environment we work in must be improved. We need to have a good working environment. Not just, of course, the infrastructure, the buildings, but you also require the correct equipment and medical products, health products and technologies. So when you have all this in the right proportion, and also with the right number of staff, then we are sure, you can be sure that the best possible quality of health services will be provided. I can tell you without fear of contradiction, most of our staff, as Mheshimiwa had asked earlier, we have, like, dispensaries are run by one nurse. So one nurse does everything. They open the clinic in the morning, they clerk patients, that is, they take the history of the patient, they administer medication, they do reporting, they handle the claims, like now under the Social Health Authority. They are also the managers. So they basically do everything that is done in a hospital setup by one person. So you can be sure, other than the 1 month leave they take at the once a year, there is what we call burnout. At the major hospitals, at the hospitals, level 4, level 5 hospitals, a similar situation persists. You find that one nurse may be taking care of an entire ward at night. You can imagine taking care of 40 patients the whole night. I'm not trying to justify negligence. What I'm simply trying to say is, with the support of this House, which has already been provided in the past, and I believe going forward you will continue supporting the department, we have a list of we intend to advertise, the County Public Service Board intends to advertise for positions, 132, in the coming few weeks. Maybe in the next 2-3 weeks, they are going to advertise for 132 positions, taking care of all cadres, especially nursing, laboratory, radiology, and public health, so that we are able to. And the other thing is, with medical negligence, patients are also at liberty, or the relatives are also at liberty to engage the legal channels. On transfer of staff, arbitrary transfer of staff. What I know about deployment of staff is a normal thing in the course of work. And we do this in the best interest of service delivery. That is usually the first consideration. And of course, most of the people would wish to remain in towns for obvious reasons. But arbitrary transfer of staff is not permitted, because we have a committee that sits at sub-county level as well as at the county level to look at issues that arise for those staff who wish to be transferred, because we have many types of transfers. We have transfers where 2 staff members wish to cross-transfer. For those ones, we just, as long as the staff is able to deliver good services, we are able to do it. But for transfers due to issues of misunderstanding between the leadership or issues of misunderstanding between 2 or more staff, then those ones we would not entertain. We would always try to be as professional as possible in handling matters of transfers. But generally, the guiding factor is service delivery. On the issue of training, given an opportunity to do a training needs assessment for the entire department that will now inform which courses do we require, which trainings do we require for our staff. And then also request for funding, because these courses are expensive. We will need to have adequate funds in order to ensure that these staff are trained. So the issue of selective training, if it is there, then we are going to address it. But I remember, to the best of my knowledge, as I served, I gave every individual an equal opportunity to be considered, and also taking into consideration what we call first in, first out. The first person to declare interest in a particular training should be given the first opportunity to go for that training, because you could be a senior like myself, and I may not be interested in going for that training. Then I should not be an impediment to others who are young and they wish to go for training almost immediately for courses that are relevant to service delivery. Services, for example, we have a lot of cases of cancer. Very soon we are going to hand over the site for the construction of the cancer center under the strategic intervention. So as we are constructing this and eventually equipping it, we will require staff to run this. So a prudent, a serious leader needs to forecast that in the next maybe 2-3 years, this unit will be ready. So where will you get the staff? The time to train them is now, so that when it's complete, then we are able to have staff.
Ekuwam, maybe kindly, because of time, kindly try to be very precise, direct to the point.
Okay, thank you. On the matter of the strikes, on the matter of the strikes, what I had said earlier is that we need to engage our staff on a continuous basis, directly, and also so that some of the issues they have can be handled even without involving the union. But for matters that are canvassed by the union through CBAs, it is only logical after signing the CBA for the government to implement it to the letter. And some of the challenges for full implementation are actually beyond the department. We would endeavor to provide guidance to ensure that we request for support in order to implement all the items that we sign. On promotion of doctors, I think I've already talked about this. The funds were provided and the names have been submitted of those who qualify for promotion have been submitted to the Public Service Board. And this is one of the things that will be done in the next 1 or 2 months. On oxygen plant, this is a project that was supported by the Department of Finance. And the entire process was, the entire procurement of the oxygen plant was done by the Department of Finance. And the documents relating to this specific procurement are with the Department of Finance. The Department of Health Services was involved at the technical level in giving specifications. What I intend to do is, I am aware that there are challenges with the oxygen plant. Specifically, there is a specific challenge. The oxygen plant is working. It is able to deliver oxygen through the piping system to all the the wards. The challenge we have had, initially it was meant to fill cylinders, but that is where the challenge is. The contractor who supplied the equipment has been contacted, and the contractor is in the process of procuring the gadget that enables, because I'm told it is faulty, procuring another gadget that is going, because the plant is still under service warranty. And therefore, we expect to, if approved by this committee, to liaise with this contractor through my colleague in the, from the Department of Finance and Economic Planning, to ensure this is done in the shortest time possible. On the issue of KEMSA, we still procure medical commodities from KEMSA, but we also are expected to procure from local suppliers. So with the challenges attributed to the Social Health Authority, it is good to be honest about this. The Social Health Authority, nowadays called Taifa Care, with Taifa Care, it is a good program, but it has challenges. It is good to admit there are challenges, and part of the challenges relate to issues of registration and issues of the portal, the registration portal, the issues of reimbursements to facilities. There are delays in reimbursements. There was supposed to be capitation, particularly of level 2 and level 3 facilities, which has not happened. So I promise this committee, I undertake to ensure that I liaise with the manager of the Social Health Authority here in Kericho, and even get in touch with the leadership in Nairobi to find out what can be done. Although I believe this is already work in progress, because at the beginning of this week, His Excellency, the Deputy President of the Republic, had a roundtable meeting with all the stakeholders to try and address this. On the issue of, so what we need to do from our end as Kericho is to continue the registration and go beyond registration, because that has been part of the challenge of SHA. Many people register, but they fail to remit the contributions, the premiums. And that's why the other day the Cabinet Secretary for Health gave an update that about 19 million people have registered, but only 3 million are active contributors. So that has been part of the challenge with this system. On the issue of facility upgrade or downgrade, this is a matter that is categorization of health facilities is a function of the Medical Practitioners and Dentists Council. As a county government, our role is clear. We have the criteria that is used to grade the facilities, to categorize. So we shall endeavor to ensure that all our facilities are to the required standard by giving the correct investments, which this assembly has been able to do. So my responsibility, if approved, would be to ensure whatever needs to be done to upgrade these facilities is actually realized.
Thank you. Thank you. Now, I think we are through that side. Honorable members, you see the chair had given an instructions of strictly one question each before I give another ruling. Now, I'll allow only, I think only one member has a question.
Yes.
So kindly ask the one question you have.
Thank you very much, Chair. Now, Dr. Ekuwam, we understand that it was very much devastating when in the healthcare. How you be, if given that opportunity to be the CEC, to handle such a matter like the one that happened in Londiani? Finally,
Thank you.
with that, you can give us an insight on what is happening with the national referral and the funding that was given out. Is it for referral hospital or it is for the current hospital in Londiani?
Thank you.
Chairman.
I have a very quick one on the Banton.
Thank you. Dr. Ekuwam, let me take this opportunity to give you my sincere congratulations for appearing before this honorable house for the second time. Previously, you appeared here as Chief Officer in the Department of Health. So, Dr. Ekuwam, I wish only to bring to your attention that Kericho Referral Hospital is in a sorry state. My words. The residents of Kericho do not have any confidence, evidence, and trust. I want to agree with you. You said when a complaint arises, there must be a reason. And there must be a reason. And should not be ignored. It takes several weeks to be attended to. Man use. I was there yesterday. The meaning of referral, meaning that facility can be able to handle complex cases that are referred from lower levels.
Honorable Anton, is it a question or
Do you
a
know
comment?
what yesterday? I was there. Somebody was being referred to Litay. It beats common sense. Kericho Referral Hospital is supposed to be at another level than Litay. Another thing again that is wanting in that facility. In fact, one of the patients was whispering to me, that Mweshimiwa, even wheelchairs that are there are wanting. Beddings want, they are in sorry state. What am I trying to say in Dr. Ekuwam? I personally have a lot of, because you know every corner of Kericho Referral Hospital. And if we don't take positive steps to salvage this facility, then it was the last one in
I think it was
donor funds. It is in public domain that USA has stopped donor funds. What mitigations are we going to put in place? Are you going to put in place to see to it that the services that we used to get through donor funds can continue without being disturbed?
Thank you. I think it's what you've got it. You don't even have to comment. In case this committee finds you fit, then those are the things.
Our Chair, Daktari, I want to congratulate you for having a lot of experience, especially in the Department of Health Services. In your own opinion, what is the status of health services within Kericho County, especially including the services, the ambulance services? What is your rating on the same?
Thank you. Maybe Honorable Sile.
Thank you, Chair. Daktari, you have explained yourself. You are well conversant with our county. I've got only one reservation. What do you want for us that will help you to make our county prosper in the side of health sector? Thank you.
Thank you, Honorable Siede. You can now finish answering, then you give us your closing remarks. I don't think any one of us will still have to speak. Thank you.
Thank you, Chairman and honorable members. I would like to respond to these questions on the status of the question from Honorable Francis Terrer on the status of health services, particularly ambulance services. The county government has 14 ambulances, and these ambulances are spread across at least every sub-county hospital has an ambulance, and we still have another 8 that are stationed strategically in order to be able to handle emergencies as and when they arise. Secondly, these ambulances I'm talking about, the 14, are fully functional. They are fully functional and they're well serviced. The other thing is that with the passage of Taifa Care, now we have Taifa Care. Taifa Care introduced an element which was not existing under NHIF, which is the emergency, chronic illness, and critical. Chronic and critical illness fund. So under this emergency services, it means that every resident is able, all the citizens are able to access medical services anywhere without having to pay. Even if you had not registered, the moment you arrive at the hospital, you are registered immediately and you are given a service. A case in point is the other day when we had some poisoning, food poisoning in Londiani. All the patients who were treated there were sorted, their medical bills were taken care of by Social Health Authority. In terms of referral, the ambulance services is part of the emergency care. So anyone who requires emergency referral following an accident or any other medical emergency would be transferred by our ambulances, without having to pay. The facility will claim for that particular service from the Taifa Care. So that issue of patients being asked to pay for ambulance services, to pay for fuel or to pay for any other thing, that is now history. If it happens, then we need to be informed immediately, because that is irregular. This assembly has been gracious enough to allocate enough budget for service of these motor vehicles, both utility and ambulances. It has also been able to give us adequate budget for fuel. So there is really no reason why anyone should be asked to pay a single cent for emergency referral services. Occasionally we get requests for referral that are not emergency, where you need to use the ambulance, but not for emergency. That means you can as well use, for example, for cold cases. You may have a growth somewhere, or maybe you require an operation that has been scheduled to be done maybe in the next 1 month or 2 weeks. So for such cases, that's where we expect the client to pay, because it's not an emergency. But emergency services, strictly no payment. Then we also have a call center in the Department of Health Services, a call center that is manned 24/7 by a clinic officer and a nurse. So this call center, the number is 0724 035 035. 0724 035 035. This is a number anyone can call at any time to seek a service for emergency services, particularly. If there's an accident anywhere within our locality, within the borders of Kericho County, and you need the ambulance to come and rescue, you can call this number. You can also send an SMS. You do not necessarily have to call. so that now we engage the nearest ambulance to the site of the accident. Then on the issues raised by the Honorable Anthony Ruto, the MCA for Kipkelion, I have noted your concerns. They are actually serious matters that will form part of my 100 days. Actually, 100 days is too long. Within the first month of assuming office, if approved by this committee, I will address these matters immediately. On the issue of withdrawal of funding by USAID, this is a matter that is affecting the entire nation. At Kericho, we are also affected. I would like to thank this assembly because in the previous government, the second cycle of devolution, it's like we had anticipated.
Maybe to inform on that matter, I think it was actually in the Court of America.
Yes.
The Court of Appeal quashed the same. So I think we will still receive funding for some times before that case is determined. I can request that you move to the second question, if possible.
Okay. Yeah. Okay. Then the other one is about the issue of Londiani accident. It is unfortunate what happened that time, and the department tried its best to manage the situation because we were able to mobilize staff from Kericho, and a number of staff, the patients were, those who were badly injured were stabilized and referred to Kericho. It's unfortunate, the circus that happened thereafter is unfortunate and regretted. But there is funding that we expect from one of the development partners, the Brighter Communities Worldwide, who intend to set up a trauma, to support us to set up a trauma center in Londiani specifically. That will address this. But in the meantime, we are in the process of sending more staff to Londiani in order to be able to assist in managing cases. On the issue of, there is also another budget, another support that we expect. We expect from one of the development partners that is also supposed to upgrade, not upgrading, but that is supposed to also help us to establish an outpatient block, offices and theaters and wards in Londiani. So it's not for the national referral. It is specifically for the Londiani Level 4 hospital.
Then, move to the next question for
yes.
Honorable Francis.
Yes. I've responded to the question by the Honorable Francis Terrer.
Now, Honorable Shade.
Yes.
Yes.
On that particular question, what I'm requesting from this Honorable Committee and House is your support in totality. Following this process, and also, if approved, I would be presenting to you requests to mainly, the main challenge is health products and technologies, basically medical commodities and staffing. Those are the two areas that I would really wish to get the support of this House in order to be able to ensure good service delivery to our residents.
Thank you very much, Dr. Ekuwam. Can you give us your closing remarks, if any?
Thank you, honorable members and Chair. I would like to thank you for the opportunity to appear before you and for the deliberations that have taken place. I would like to request that you find it in your favor to consider me once you retreat to do your final report. And I undertake to serve the residents of this county without fear or favor, and that the best possible healthcare services will be rendered to the residents. Thank you.
Thank you very much, Dr. Now, we are coming to the end of our session. On behalf of the County Assembly of Kericho and the Committee on Appointments, we want to wish you all the best in your current and future endeavors. Thank you very much. It's now my request that the Sergeant at Arms, you escort the nominee. We have lunch at our luncheon. Make sure Daktari amepata lunch before he leaves. Otherwise, the county assembly staffs, we want to thank you for the session that is coming to an end now. Thank you very much. We all proceed for lunch. Then we come back at exactly 3:30 for the next